In this episode, I want to talk about perimenopause, especially because I am 47 years old and I am definitely going through all of these symptoms. Welcome to the Happy Beyond Fit podcast, episode number 3. My name is Maria Browning. I am a former synchronized swimmer from Colombia turned into a lifestyle entrepreneur. So let's start understanding what menopause is. Menopause is the moment in which we women no longer menstruate. And it's decided by the amount of time that you have been going without getting your last period. So once it's been 2 years, it's official that you are in menopause. If for 2 years you have not gotten your period. Now, perimenopause can start 10 to 15 years prior to menopause. Meaning, if you are in your 40s, for sure, you are going through the process of perimenopause. So let's talk about all of these wonderful symptoms because I want to embrace nature, embrace our beautiful bodies and all the changes. It doesn't mean it's easy, but the reason why I want to talk about it is because we need to understand that there are options to help us to deal with all of these symptoms. So let's talk about the most common symptoms or the easiest way for you to know if you are going through perimenopause. The number one symptom that gives it away is if you are having hot flashes. If all of a sudden your internal temperatures raises up and you turn red and you start sweating like crazy, and this happens several times during the day, then for sure you know that you're going through perimenopause. But that it's not necessarily the case when you first start perimenopause. Maybe that starts happening when you're getting closer to your menopause years. So maybe you're experiencing night sweats. Like that is my case. I am not going through hot flashes, but I am definitely going through night sweats only when I have my period. And I started experiencing this change only 2 to 3 years ago. It had never happened before, but when I am on my period at night, the sweats are real. I am like on a bed, on a pool. My bed becomes a pool. I have to sleep on a towel because the sweats are unstoppable and obviously disrupting my sleep. So that's another symptom that you are definitely going through menopause. Another very common symptom is your inability to sleep or to rest. Maybe you are having insomnia, or maybe you are waking up several times throughout the night. Maybe you have to pee a lot during the night. That is another sign. And then you're not able to go back to sleep, or you can totally tell that if you go back to sleep, it is not like you are resting. You wake up feeling tired instead of feeling rested. Another common symptom is the decrease in libido, in your sexual desire. Maybe it is because you're experiencing vaginal dryness, and when you have intercourse, you are experiencing pain. And let's face it, who wants to have sex if it means that you are going to go through pain? Which is something I needed to educate my partner on. It is not that I am no longer into you or I don't desire you as much as you desire me. It is only that depending on the time of the month, because definitely I feel the changes depending on the 3 different cycles we go through the month: the first 10 days after the period, the middle 10 days, and the 10 days before the period. And sometimes I do feel that dryness and pain, especially on the 10 days prior to my period. So I am definitely not interested in sexual intercourse during those days. But it is not due to any attraction or anything that is going wrong with your relationship. It's simply because you just don't want to go through pain. Maybe another one of the common symptoms is breast pain. If your breasts are constantly tender and even to the touch of the clothing. Another common symptom is urinary incontinence, or maybe when we are exercising and we are jumping or doing some high intensity moves and we feel like we are leaking pee, or when we cough or when we sneeze, then some pee comes out. Then that's definitely another symptom, another sign that we're going through perimenopause. Maybe you are experiencing irregular periods, because that's the number one question that your OBGYN is going to ask you when you bring this up in your consultation. They're going to ask you how your periods are going. So my periods are still very regular, very on time, and very much the same, even though I started experiencing a couple of years ago, I started bleeding a lot during my period, and that had not happened before. So heavy bleeding is another symptom of perimenopause, or when the periods are irregular. Maybe you're having them too often. Maybe you're having your period every 2 weeks, or maybe not as often, so you never know when you're going to get your period. So all of these signs are definitely that you're going through perimenopause. Maybe you're having palpitations. That is another common one, or like some chest pain or palpitations. Another common symptom is anxiety, or our inability to deal with life's challenges in the way that we used to. Sometimes I feel like maybe I'm getting too tired, but I don't understand why life is beating me up harder than ever, or like I get so physically and emotionally exhausted when I'm dealing with problems. And it is because we obviously, with our hormonal changes, we are not producing the hormones that we need in order for us to stay calm and to tackle different situations. If we're producing, for example, less testosterone, then we feel less motivated to go after the issue and tackle the issue. If we're producing less progesterone, then we don't have the ability to calm down and to find peace. So we start increasing our level of anxiety, which can lead into other coping mechanisms that may not be healthy for us. For example, it may lead to compulsive eating, or to getting into drinking more alcohol, because now we're getting anxious maybe towards the night because we don't think we're going to be able to rest, or we cannot stop thinking about the issue that we are going through, and now we're trying to rely or on something external to help us to cope with it, and this is also not going to help, right? Maybe another one of the very common symptoms is metabolic changes in body composition. So with menopause and during perimenopause, we lose muscle mass, therefore we lose bone mass as well. And this can lead into an increase into visceral fat. So now, uh, because we lose muscle mass, our body doesn't metabolize as well anymore. So even if we don't change anything in our diet and we're still exercising as much as we have done it for years, we start gaining weight around the waist area, everywhere and around the waist area. In particular, that's a very common sign of perimenopause. So it's the visceral fat, the one that really affects us at another level, because now we don't feel as pretty, we don't feel as comfortable in our own body. So now it's affecting our psyche, it's affecting our ability to feel good with our clothes, to feel confident in ourselves. And then we start dealing with the extra issue of the positivity and retraining ourselves on embracing this new body of ours, because it's what's going to happen with age. And we resign to all of these changes that we have to go through, right? Now, another common symptom may be changes on your nails. They start getting weaker, or changes on your hair, thinning of the hair or hair loss. Another common change may be urinary tract infections. They become more common during this time. So now we have to be extra careful with hygiene. We have to be extra careful when we're exercising and not to stay on sweaty clothes for a long period of time, because anything can cause a urinary tract infection, or to be extra clean, especially after having intercourse, because it can lead to an urinary tract infection. Another symptom is mood swings or irritability. That when we feel that something snaps inside of us and we get mad at people, maybe for no reason. I am very aware of this, especially during the 10 days before my period, that sometimes I feel like I want to cry. And because I journal every day, I journal my feelings, and there's really not a reason for me to cry. There's nothing going on. So I know that I really literally want to cry for no reason, or that I am upset for no reason. So journaling has helped me a lot because I am able to identify when I'm feeling this, not because somebody has done something to me, but it is just my inability to cope with these feelings. And then I realize that I represent a threat to myself. So I tell my boyfriend, be careful during these days because I may be irritable, or I may be not as happy as usual. So maybe these are not the days that we're going to plan on having a romantic date or to be together for a long period of time, because I know that I represent a threat to myself. I prefer to just be in my own cocoon so that I don't create any issues with anyone just because of this. Another symptom may be an increase in headaches and migraines, especially during the days prior to our period. And if we have had that issue of having headaches and migraines prior to perimenopause, then now it may get worse, like it is my case. Exactly 4 years ago, I started having migraines every single day for the 10 days prior to my period, every month. And that's what got me to go to different doctors, because I couldn't understand what was happening. So when you go to the OBGYN, most of them are going to just do the regular hormonal test that apparently is not as detailed as it should be, and then everything comes back normal, because unless you are really in menopause, then that test is not designed to see the hormonal changes that we're already going through. So for years I've gotten the result that my tests are fine, and then my answer is, so you think I'm making all of this up? Which clearly I am not making it up. I have been able to understand throughout the past couple of years that I've been reading several books, and I've been listening to different podcasts and different doctors who now specialize on menopause. Have been able to understand that this is new knowledge, that the doctors have not been trained, not even the OBGYN have been trained to know in detail how to deal with perimenopause and menopause. So now what we have available is some doctors that have decided to take this route and become specialists for women that are going through all of these changes in menopause and perimenopause, and to provide us with the information about the options and how we can help ourselves to improve our quality of life. I have also recently learned that another one of the symptoms is that during the perimenopausal years, we are more prone to developing autoimmune diseases, which doesn't surprise me, because 3 years ago I was diagnosed with rheumatoid arthritis, which is one of the common ones that happen to women when they are going through perimenopause. Also, thyroid issues, Hashimoto's disease. So all of these things, guys, if you have been experiencing a lot of these symptoms, you're not going crazy and you're not alone. And you don't have to resign to living a life of just getting worse and worse and worse. We have options, and I have decided to embrace these options and to give myself a chance, because for the last 2 years that I've been going through all of this process of investigation and research and learning so much about all the information that is out there nowadays, I have always tried to tackle my body issues, my physical issues, health issues in a holistic way, which means looking at the body as a whole, not just the body separated from the mind and the spirit. So I want to implement everything in a natural way first. And that's what I've been trying to do for the last 2 years in particular, even though I've been experiencing all these body changes ever since 4 years ago when I turned 43. And so I have done everything that everybody tells you to do to help yourself with, to balance your own hormones, which most of these advice that you're going to receive are going to be: number one, take care of your sleep. Make sure that you can sleep very well, which, by the way, if it's beyond your control that you can sleep, then how can you make sure you can sleep? So then you start taking melatonin or taking anything to help you to sleep, but apparently that's not the way, because that only makes you sleep, but it really doesn't allow you to rest and recover. So I thought I was doing something good by taking melatonin. Apparently it's not good, so I stopped taking it over a year ago. So but anyway, making sure that you have good sleeping habits is the main thing. That you start lowering the lights at night, that you're not on the screen checking on your social media or working until very late, that you eat 2 or 3 hours before you fall asleep, and that you respect your sleeping time instead of just like carelessly staying up late as we used to do when we were young. Which I am sure you guys, if you're listening to this and you're feeling these perimenopausal symptoms, I am sure that you're already trying to take good care of your sleep. Now, they also tell you that you should eat the right foods, feed your gut microbiome. And these right foods are going to be vegetables and fruits and herbs and anything you use to season your food, that at least you should have 35 different kinds of them every day, which is very overwhelming, but not impossible. We can make it happen. So I've been trying to implement these all kinds of varieties of vegetables and fruits and herbs every single day. And they also tell you to reduce your stress level, which I have also been tackling, and introducing meditation into your life. And instead of stressing yourself much more, even with the way that you work out, trying to do other kinds of workouts that don't cause so much stress to your body, that don't push you that much. So I've been into developing the habit of daily nature walks. But they also tell you that you should exercise and you should do resistance training, and that you should be having at least 150 minutes of exercise a week, which I'm definitely doing on my own, separate from the days that I work teaching Zumba trainings, which those days they are at least 250 minutes per day of exercise. So that doesn't count my 500 minutes during the weekends while I'm working, just extra. So I am tackling that too, and doing resistance training as well, which can be lifting weights, or you can use your own body weight as well. And they tell you to do different things that are going to increase your metabolism. You can try intermittent fasting. It helps you to increase metabolism. You can also try different tricks like I've been doing, like getting in the habit of doing saunas constantly, and cold water immersion as well, because it activates your hot and cold shock proteins, and this is going to increase your metabolism. So that's what we want to help the body with, so to continue to create the right hormones that we need, right, in a natural way. So guess what, I've been doing all of this, and even though some symptoms have improved, I believe that for most of them I have just gotten more used to having them. And like, for example, my migraines have not decreased prior to my period every month. I have changed to, when I'm on my period, using only organic tampons. And once I changed that, exactly a year ago, I stopped having cramps, which was mind blowing, because it makes me think, what if I've been having menstrual cramping all my life, which has been very intense, only because I've been using the wrong products and my body has been just trying to fight all the chemicals inside of me? Mind blowing. Anyway, I'm only using organic tampons, and I no longer cramp, and I no longer bleed that much. So, important thing to know. Maybe it was just a coincidence. Maybe it's just me. I am just sharing. Um, Other than that, yes, I have reduced my level of stress. I have changed my life, my working hours. So that has helped with my anxiety. But there's some other times in which I'm anxious, especially at night. I never have had this issue before that I want to eat at night. And I know that I am eating out of anxious feelings. And I just want to eat so that my body makes me start the digestion process and then it puts me to sleep. So I don't know if it's related because for over a year, 3 years ago, I was not able to sleep because I was going through an injury on my neck and my shoulder. It was so painful that I could not sleep. So maybe I think I have some kind of PTSD when the night comes, thinking that I'm not going to be able to sleep. But now I believe it is more due to my hormonal changes and my inability to tackle life's problems as I used to, and now being able to not not being able to work with my anxiety levels on my own, right? So why am I so sure of that right now? Well, because exactly 7 weeks ago, I went to a menopause clinic and they did the blood test that is very specific to check on hormonal levels. And then I realized that my testosterone levels are very low. So, just so you guys understand, testosterone in women is as important as in men. We just don't produce as much as men do, but we constantly produce it. So the normal levels of testosterone in a woman go from 5 to 60 or 70. It depends on, every lab place has a different range because they have tested these with different groups of women. So let's say from 5 to 60. But anyway, anything lower than 20 is considered very low testosterone production. So my testosterone is at 10. In men, it goes from 300 to over 1,000, 1,100, something like that. So notice that men's testosterone is way higher, but we also produce it constantly as men do. Now, our testosterone production, some is produced in the ovaries and some other is produced in the adrenal glands. And let's understand that the adrenal glands are in charge of producing cortisol and adrenaline, which are the chemicals that we produce when we're stressed out, because these are the chemicals that help us in the case of flight or fight, the survival mode, when we need to do something to survive. So if you are going through a period in your life in which you are constantly stressed out, which means to me, I'm just mentioning this because I started feeling all of these changes in my body 4 years ago. And what happened 4 years ago? If this is 2024, 4 years ago, we started the pandemic, right? So I thought that I was just stressed out because of the pandemic. So maybe because of the pandemic years and all the changes and how it affected my job, then maybe I was overproducing cortisol and adrenaline because I needed to develop new ways for me to continue to earn money. And maybe the overproduction of this, if our adrenal glands are too busy producing cortisol, then it lowers the production of testosterone. So maybe that's when you started. Maybe it was going to happen anyway because that was my age and I was supposed to start perimenopause at that time. Who knows? And a year later, I ended up with a diagnosis of rheumatoid arthritis, which is also due to high cortisol levels. So clearly, I was chronically stressed, having a high production of cortisol. Then clearly, that could have been the reason that my testosterone levels got lower. So anyway, another of the big symptoms that we experience during perimenopause is the reduction in energy levels, the constant fatigue, and we feel like we're dragging ourselves throughout the day, which I've been feeling that for the last 2 years. Is hard, and also because my job teaching Zumba trainings is so physically demanding, and I use all the last little drop of energy that I could use, then of course I'm extra tired after teaching the trainings because I am going through all of these different hormonal changes, and I am constantly out of energy, which I also have hypothyroidism issues for 25 years. So I always attribute my lack of energy to hypothyroidism, but then it started getting worse. Another symptom, girls, if you have been experiencing this constant tiredness, and like more than tiredness is a fatigue, is a constant fatigue, also inability to get motivated about things that used to get you super motivated. Like for me, I used to like have an idea and get up, okay, let's do this new project, new idea, let's work on this. And then now I have the ideas and I'm like, nah, why would I do it? Why would I want to get into it? So it's like I cannot push myself. Like, for example, I've been wanting to launch this podcast idea for the last year. Why? Not because I have a huge expectation about this, not because I want to develop my skills to be able to talk in a camera and to interview other people and to share the knowledge that I have acquired with whoever is interested in it. So just because I want to develop the skills, I've been having this idea for 1 year. I've been planning for it, organizing, getting the microphone, setting myself up for it. And for 1 year, I have not been able to do it because I lack the motivation to take the step to go for it. So that's another big one. It's a drastic change in my motivation levels that I never had to struggle with this before. I used to be so driven to work on so many different projects. And if you have known me for a while, maybe you come from the Zumba world, you have known that I am the one person that is constantly innovating and bringing new things and trying new ideas and creating one company and then another one and launching one program and then another one. And like, there's always something new happening in my life. Well, that has not been me for the last 2 years. If anything, I have put everything on pause. Why? Because I just don't feel with the energy to do anything or the motivation or the drive to do any of these things. So anyway, 7 weeks ago, I get my results. Testosterone levels are low. Obviously, these hormonal tests depend on the time of the month that you took the test. So they also vary, but it gives you a better idea of where you are. So I was supposed to be on the days that you're supposed to have a higher production of testosterone, and I am there in the lowest end. So what are the options? I decided to say yes to HRT, hormonal replacement therapy. My estrogen and progesterone levels are still good in the normal range, but my testosterone is very low. And precisely because my job involves a lot of physical activity, I decided that I want to give it a try and see how it changes my life. So I decided to go for the pellet. So these are the options when for any kind of cocktail they're going to give you. And I'm sharing with you guys the links on podcasts that I have listened to with doctors, specialists in doing the research and treating patients regarding menopause and perimenopause so that you can really understand this. I am in no way trying to speak for a doctor here. I am sharing what I have learned and what I have given myself the chance to try. You guys, please do listen to these links of these amazing podcasts that I am sharing on the information of this podcast, so that you can also have all of the information that I have acquired. So you can have these hormonal cocktail that they prepare for you depending on your needs, because we're all different. You can have it, apply it to yourself on your skin with a gel or with a lotion, or you can take it on a pill that is processed by your liver. Therefore, it may affect your liver function. So that's the one that is the least recommended. So absorption through the skin is better, as well as absorption through the blood. So there's also injection shots, and there's also a pellet, which is like a grain of like a rice grain that they put under your skin on your butt cheek, and is constantly shooting the hormones that you need. And it's supposed to last 3 to 4 months. So because I was going on a trip, international trip for 3 weeks, which I had not done in the last couple of years. I've been traveling for at least for no longer than 10 days doing my business trips every time I go international or even in the country, in the United States. But this one ended up being for 21 days, and I was in panic, thinking, I am going to collapse with no energy. How am I going to work? Because it's not like I'm going on vacation for 21 days. I'm going to work teaching Zumba trainings and classes every single day. How am I going to survive this? So that's the reason why I decided to say yes. I need to try anything and let's see if it helps. So I could not do the lotion or the gel because of the amount of sweating I go through every day during my job, and then I have to shower again because I'm sweating and go teach another class and another class. So that would be too much. I'm having to put sunscreen on because I have to teach aqua Zumba classes. So I figured that would not be a recommended method for me. So I went for the pellets. So they placed the pellets 7 weeks ago. And guys, the next day after I got the pellet, I had to travel to New York just for a day, business trip, going and coming back in a day. And then for the first time in the last 10 years, I was able to sleep on a plane again. I can no longer sleep on planes because anything that gets me excited, my body's still taking it as if I am stressed out. So then I get anxious. So then I get uncomfortable. So then I cannot bring myself to peace and I cannot even sleep on a plane anymore. I feel like I have to be alert and I have to be planning. Or if I'm in the way coming back after working, I'm way too tired and exhausted, like for me to relax and sleep. Next day, I get on a plane, fell asleep before I took off, and woke up when we landed, as I used to do for the first 8 years of my traveling working career. Because in my job, I have been traveling for 18 years, with the exception of the pandemic years, for every week at a different city or country to teach Zumba trainings and classes. So I used to be able to sleep like a baby on planes. But for the last 10 years, I don't know what happened to me. I have not, at least 10 years. I say 10 years, but it's probably like eight, I don't know, 8 to 10 years. So, anyway, next day after getting the pellet, I was able to sleep amazingly. And then I noticed that I don't think I've been having issues sleeping. I do wake up a couple of times during the night to have to pee now for the last 3 years. But I am able to go back to sleep, or so I think. Well, now I'm really able to go back to sleep. So the difference in quality of sleep has been tremendous. And the difference in me not getting so anxious to the point that I can even sleep on a plane has been tremendous. So that I experienced it from the very first next day. Day one with the pellet. Day two of the pellet, I woke up full of drive and inspiration, contacted a friend, interviewed her, taped everything, created my podcast on Spotify, tried different AI sites and softwares to do the podcast and the editing. And guys, in one day, I launched my podcast, which I had not been able to do in 1 year. And then I started scheduling the next one and the next one to interview other people and to continue to launch my podcast. That was day two. The drive, the mental clarity, the energy. Then I went on my trip exactly a week after I got the pellet, and jet lag never hit me. I was on countries with 8 and 9 hours of difference from my time zone. Jet lag was never there for me. Not when I went there, not when I would land in a different country every 5 days, not when I came back. After 21 days, I came back and my circadian rhythm was back to normal immediately. I never struggled with the jet lag. Blows my mind. So the energy levels, of course, I was tired because on my 21-day trip, I was working every single day, so of course I was tired. But I know the difference between being tired and being exhausted, which is how I am after teaching Zumba classes or teaching a whole Zumba training, which is 8 to 9 hours long. I don't reach the exhaustion level anymore. I'm tired. Yes, I'm very tired. Yes, the more I work, yes, I am very tired. Not exhausted. Like I joke with my friends that after teaching a weekend of trainings, I am like a whale on a beach. La ballena encallada. Like I cannot get out of my bed. Like I am literally stuck on my bed. That's how exhausted I am. Not anymore. Not for the last 7 weeks. I have not been, not even one day like that. No matter how tired I've been after working so much and coming back after traveling for 21 days. Very impressive. What else? The libido, then of course it goes up. So on the days I'm very in tune with my body, I know that the 10 days after my period, 10 to 15 days, ovulation days, my libido goes up, my sexual desire goes up. Then now that I am on testosterone, I am like an animal. So I am sure my boyfriend is having a lot of fun because he's like, yes, you used to be like this. And on the other days, the 10 to 15 days, 10 days before I get my period, then I used to have no desire to have sex because, as I shared earlier, then there's pain involved in it. So, yeah, I'm not into that. Then now it's like, oh, yeah, I am up for having fun. I'm not thinking about it. I'm not like an animal, blah, blah, but I am more like up for having fun, and I'm definitely not experiencing the pain. So, yeah, sexual libido has increased. And things that have not changed, even though the doctor did tell me that she did not think these were going to change. I was really hoping that my migraines were going to improve. And so I just went last week through the 10 days before my period because I'm on day 2 of my period right now. And my migraines got even worse. So I'm taking notes of all of these. She did clarify that testosterone had nothing to do with improving the migraines, so she did not think it was going to change. But obviously, I did not think it was going to get worse. And when I mean worse, it was like I take the medicine for migraine and it does not improve. It does not go away. And another thing that is amazing is my body fat redistribution. My body has changed in 1 month. I have not lost weight. Don't get me wrong. It's the same weight, exactly the same weight. But my body looks so different than everybody thinks I've lost weight. Everybody's asking me, everybody after I came back from my trip, oh my God, you have lost so much weight. I have not lost a pound. That is redistributed how it used to be before. Because for the last 2 years, I've been going through changes in my body. And for the first time, I started losing my waistline and having a belly because I am now getting the visceral fat issue that comes with perimenopause. Well, everything got redistributed, and I feel as if I look as skinny as 2 years ago when I was 10 pounds less. My muscles are more toned and they are more noticeable. And I think that's why people are thinking that I have lost weight. And like I was having like extra fat on the sides of my hips. I don't have it. I don't know where it went. I don't know why it's the same weight that I have, but it seems like it's like if I am in better shape. I can definitely feel my muscles stronger. Of course, I've been exercising a lot, but I usually do. But now when I exercise, it's like the muscle really absorbs the exercise. Now that because I've been so on point of my protein intake, it's like now the muscle is really getting the protein intake and really changing my metabolism. So, guys, this is blowing my mind, and I just wanted to share that I will continue to share with you guys all these changes because not everything's going to be great. I've also noticed that I am forgetting things in a different way. Obviously, my memory ability has changed over the years with perimenopause. But now it's like things that I'm used to doing in autopilot, like entering the code for a safe. I don't no longer remember it. And like basic stuff like that that I was not struggling with before, now I am. So I'm taking notes of all of these. And I mainly want you guys to share with me if you have tried HRT treatment and what has been the pros and the cons. If you have tried the pellet, what are your levels of testosterone that you have been maintaining and for how long? Please do help me to come to peace with this decision. And let's help each other. Let's continue to share this information. Ask me questions that you want me to address, if it's anything in particular that you want me to pay attention to. And on the next podcast, it is my goal to post one episode every month talking about my hormonal changes and how I'm feeling with the pellet. But in few words, guys, I feel like if I am Wonder Woman on this pellet. Is amazing to feel like I used to feel when I was 35 years old. It's a little scary because it feels a little unnatural. Like I'm not supposed to be feeling this way. It feels freaking amazing. I don't want it to go away. But at the same time, is it the right thing to do? So anyway, I just want to maintain my testosterone levels in the normal levels. I don't want to go above anything that is the normal for a woman. Uh, of course, I don't want to stop feeling like a Wonder Woman because I want to continue to tackle life in this way. It just feels amazing. But also, there's other things. I've only been on this for 7 weeks, and apparently, you can also start growing facial hair, and your voice can start changing, and I don't know, you can become aggressive. I have not experienced any of these. uh, your clit can become bigger, which I do see the difference during my ovulation days. It's like it's engorged, not like something that it has grown so much, but it's definitely engorged. Only during the ovulation days, and then it goes back to normal. I've been retaining water, especially during the ovulation days, but then it goes back to normal. So I'm just taking notes on everything, guys. Please do share with me anything that you want to share and ask anything, and let's continue to help each other. And if you have been benefiting from HRT treatment for a long time, shame on you if you don't share it with all of us, because we need to help each other. We need to know that we're not alone, and we need to, if there are ways for us to have an optimal way of living, then why not sharing it with everybody else? So thank you for listening, and I am very looking forward to continuing this journey with you guys and sharing with you guys. Thank you. Follow my podcast. Click the follow button so that I continue to grow. This is very new and very exciting, and I appreciate your time invested in listening to this. Thank you so much.